Hello, dear students. Welcome back to the lecture of pharmacy practice. In this, we are discussing about the prescriptions and medication orders. We have nearly completed this point, and we are up to the end of the point. In that, we have gone through what are prescriptions, medication orders, how to interpret them, each and every aspect regarding their understanding by the pharmacist, then all the requirements, legal requirements necessary to be understood by the doctor as well as the pharmacist uh, with respect to the medication orders and prescriptions. Then in communication skills, definitely it is needed by every individual in case of this healthcare profession. uh, when it comes with doctors, physicians, or the nurses, and our pharmacy field personnel, when all these are dealing with one another as well as with the patients, it is the most important thing. They should have a proper way of communication, and it is a skill necessary to be developed. And we should know each and every aspect about these communication skills. When we say communication, okay, it is transfer of information, transfer of emotions, and each and every aspect what you want to share. It is sharing, that is called as communication between sender and receiver. These things we have already gone through. Okay, the point we have started in last lecture is the barriers to communication. Very important aspects. First of all, we must know what do it is the barrier means. When we are sending some information by means of the sender, okay, or through the sender, it is said that the receiver must interpret exactly what the intention of the sender is. Okay, intention means what is the purpose for what he or she want to tell, what the sender want to communicate exactly, and same should be understood by the receiver. If anything which is uh, making hindrance for this understanding, or which is called as miscommunication, is a type of barrier, hindrance, obstacles. Many words can be given to this barriers, and they equally play a huge role in communication, because we know communication, it is needed by the receiver to understand each and everything. And in this case, with doctor, patients, pharmacists, nurses, all the information is very important, because the communication made is not that much more detail. Okay, in short, you are going to communicate, and if the thing are not understood, okay, it may create a huge problem for the patient, most importantly, because they are supposed to be unknown with the people, for pharmacists, doctors, and all. So the communication should be occurring in a fluent way. That is very important. And anything which is making obstructions to this smooth flow of the communication or sharing is called as barriers. Such barriers may lead to your message becoming misinterpreted, okay, or it is called as distorted, and there is a risk of wasting the time, okay, as well as wasting money of both who are involved in the communication, sender and receiver. And also it may cause confusion in the mind of receiver particularly. So these barriers are needed to be understood in a proper level, proper way. The barriers may occur with uh, any person, okay. Generally we know there is involvement of at least two. So sender may be having some things of which may become a barrier in their its communication, okay. Sometimes receiver may have some problems, okay. So can say at these two levels the barrier may occur at the level of sender at the end, as well as the level of receiver. Sometimes third level is also assigned, which is called as the level of medium, okay. The medium or the channel which is used for transmitting the message from sender to receiver. That medium, if not selected properly, it can become barrier, okay. Again, the selection of the medium or channel actually depends upon the sender's mood, the receiver's expectation, okay. These both things are also important. And if it is not chosen properly, okay, first of all, which are the channels we should be knowing, okay. The medium, okay, particularly maximally the face-to-face communication is said to be the most important medium, okay. But due to not possible, we cannot have the contact directly with the patients, okay, or with any other person in between you are doing communication. So you have to choose or go for some other ways of or mediums of communications, okay, like written order. Here we know communication is by means of a written. The prescription and medication order are the written forms. Sometimes reports were given, sometimes telephonic conversations is made, okay. Letters, in regular way we are having some many other channels like magazines, television, radio, okay. And nowadays WhatsApps, Facebook and many other things are there, which all are said to be the channels of or medium of communication. So in all these cases the barrier can also be possible, okay. So these are different levels at which the barriers may be created in the communication, okay. The hindrance is observed and which is needed to be understood. So when at this important level of healthcare professionals, okay, it is very making a huge impact over the health of the patient importantly, because it is directly changing the meaning of message. If the barrier is there, okay, what the sender want to say, and if the receiver is not understanding or misinterpreting, okay, sometime completely not understanding, or sometime some half percent or few of the things were understood, so they are meaningless, okay. And there are many such types of barrier possible. uh, the physical barrier, okay, actually there are many. Here we have noted only three, and in next slide again we are be covering all the details. The physical barrier, these barriers these barriers include many things, okay. But like environmental and natural conditions. See, environment and natural conditions generally which acts as a medium again, okay, which obstruct the free flow of the message. When the message are sent by the sender, the physical barriers, for example, like walls, doors, okay, and the distance between the both, these all are sort of environment or the conditions which are found over there, okay, which makes a not the message reaching properly or effectively, so the communication becomes less effective because of the voice or the words spoken by the sender will not be heard properly, okay, because of the distance or the space in between both, okay. And some environmental factors, like we know, some windy conditions, some thunders are there, yeah, lightning, if it is there, okay, these all also may cause a problem. Then another example in this case, we know this technological problems are there, like the telephone calls are disconnected, okay, or the voice is not clearly heard due to not the range is not there, okay, many problems are there. Even we know the sometimes the mobile phones or the lines are not clear, okay, they are having some problem. So all these things may be called as a physical barrier, okay. So it is having inclusion of that two important aspect, the noise, okay, just I told, like any other problem, the words which are spoken, if it is a crowdy condition, we know at the counter, okay, when the communication is made generally at the counter, there are number of patients simultaneously arriving, okay, and the problem in the communication there, and that problem is called as a physical barrier, okay. Sometimes there is a disturbance by the some machineries which are operating over there, like printing machines, sometimes telephone sounds which are there, okay, ringtones, yeah, we know in meetings, even importantly the what it is called as in lectures, okay, if somebody's mobile is ringing, okay, that is a sort of noise, physical barrier created by the noise, okay. So it becomes a sort of interference with the proper communication or transferring the message from the sender to the receiver, actually, which is an external disturbance. And the space, we know space because the distance between both, which is should be actually not that much closer and not that much far away, okay, one should be able to speak in that much tone, okay, so that they should be will be hearing one another, but several time, okay, space is necessary to be maintained. And in generally in the big institutions or big hospitals, the doctors, okay, if you'll take the examples of the directors, okay, the managing bodies of the hospitals, and might be the pharmacists, nurses, or lower level of management workers who are there, okay, employees, okay, they will not be able to directly go that closer to the such people managing bodies, okay. There is always a space maintained, and it might be due to the relationship, that is the barriers, okay, the superior, they are superior, okay, as per the designation or the post, okay, or they several times they are not feeling comfortable, that need to be have needed the separation, sometimes the closed doors of the office, Okay, sometimes the separate office of uh, different personnel. So these all creates the physical problems. Okay, the environmental conditions, again not only the thunder, the rain, sometimes wind, all these things are making a problem in the understanding. Again to this we can add the temperature. Okay, we know temperature, the heat which is there, okay, in generally the summer, the temperature we know is reaching in general in at our area, we know where maximum it may reach to 47. Okay, so that is the very much difficult to humans to tolerate such heat. Okay, and due to that environmental factor which is people doesn't able to communicate properly. Okay, we know in lectures if the temperature is high and teacher is teaching over there standing 1 hour and there is a continuous sweating. Okay, even students are feeling hot, they are not comfortable with that and they are also sweating. So these is a temperature barrier, or s- said to be environmental barrier in this physical barriers. Okay, then in this also can you include the time, because the time the chosen for communication should be proper, it should be accurate one. Okay, generally what time should be there for communicating with any person, that should be properly chosen. Okay, depending upon the level or the your interpersonal relationship. Okay, when because if you are friends, you can contact with one another at any time, even at night at 12 o'clock, 1 o'clock, you can call one another. But you cannot to call to some persons, again if you'll take the examples to teachers, generally we are avoiding. Okay, by calling at night. So these things are there. Okay, the time which is also said to be a physical barrier. Then sometimes the another physical barrier cause you can also add to it is the information which is overflowing. Okay, the same information if again and again told to some person, and which is called as overflow of the information. You are giving the same uh, information, same guidance, same words were repeated in any communication, which is called as overflow. Okay, and additionally if somebody is not understanding that, it is also called as overflow. Okay, मराठीत म्हणतात ना डोक्यावरून जात आहे का. If you are not understanding, it is also said to be a physical barrier. Actually it is under the psychological barrier, but if by means of the overflow which is there, additional words which are repeated again and again, that at that time it is possible. Okay, so these are the physical barriers. Then lack of privacy, we know. Okay, we'll be discussing this in the physiological barriers. Okay, or you can also say not physiological barrier, but in the gender barriers. Okay, or in the cultural barriers, this lack of privacy will be included. Okay, and about the telephonic barrier, just I have told. Okay, many problems occurs when you are doing the telephonic communication. Easy example will take like that, if somebody is ill, yes, a patient definitely. Okay, and if nowadays what it is happening actually. Okay, in this corona period, the doctors are not physically checking. Okay, means they are not directly touching the uh, these patients. They are talking on telephonic sometimes. Okay, they are asking to get the what it is called as treatment. Okay, by calling only, by call only, they were giving the information, but the effectiveness is very less, because the diagnosis what they will be doing, if you are personally or physically going to the doctor and on telephone, both will be having a number of problems, or can be said to be a barriers, because nobody will be able to, means depends upon the skills of the doctor actually, but several time it is bit lesser effective. Okay, telephonic, which is said to be again a barrier. Then again example you can take is somebody is ill again, patients, if you are personally going to the patient as a relative or as a friend, okay, that patient will be feeling more comfortable, and if comfortable means they will be feeling better, that XYZ person, my friend, has came to me to ask about me, what, how will the, what problem is there, likewise. Okay, and if you are only asking on telephone that uh, hello, how are you, and what is the problem, likewise, so these things said to be not that much more effective, okay, as compared to our regular communication, which are there said to be a part of physical barrier. Okay, similarly there are many barriers which are there. Okay, those actually affect the communication. Okay, they are also called as the factors or the obstacles. uh, there are many. Okay, these all necessary to be understood. Okay, let us tell you in, we'll be discussing in short actually. See, psychological barriers which are there. Okay, many psychological means the influence of the state, that is mind, psychological state of the sender and receiver, which is problematic. Just I told, the emotional conditions of the both are very important. They should be cool and calm, okay, particularly the doctor, okay, or the pharmacist or the nurses with the patients. Psychology of there should be very proper. Okay, if they are having any mental disturbance, they may will not be able to make a proper communication. And the psychological barriers, the involvement of things like lack of attention. Okay, there are, if somebody is not having a proper concentration over the person what who he is speaking. Okay, if anybody is distracted by the mind, okay, physically only present, and mentally they are wondering here and there what it is generally happening in your lectures. Okay, due to there might be some reasons, like you are preoccupied with the your own problems. Okay, you are feeling something different, or you are thinking something different, so in the communication we will not be able to make a proper attention or concentration. Then poor retention is another physical psychological barrier. Okay, you retention means the ability of your brain to uh, understand, or to bring, remember, or remind all the things what you know. Okay, there is poor retention. Then emotions, main emotional aspects are there, like fear, nervousness, stress, anxiety, mental problems which are there. Sometimes mistrust. Okay, you, if you are not trusting doctors, nurses, or that time, okay, sort of emotional barrier it is there. Then anger, if we'll take, okay, if you are angry, okay, somebody, some person is angry, and he is doing the communication, we know generally when any person is angry, okay, the communication will not be proper. Okay, because they have to regret afterwards, and due to that the misinterpretation is majorly possible. Then in psychological barrier again, mature evaluation. Okay, several time you are hurry, making hasty decision, quick judgment. Okay, jump to the conclusion very fast. Okay, without hearing the complete sentence of the communicator or the sender. Then sometimes closeness of your mind, you are not listening. Okay, you have decided you are in selfish in nature. Okay, you put your own needs and problems above all. Okay, and that is generally the regular habit of any man. It's human beings. Okay, and they will be only filtering the information what is their important thing. Okay, for their betterment they will be only listening to that. So that is the closeness of mind. Sometimes you are not trusting, I just told you. Okay, then in physical barrier, just we haven't actually covered these physical barriers. Okay, see, light, noise, privacy, distance, temperature, the environmental factors which are there. Okay, then some physiological factors which we can say. Physiology means the body of the person. Okay, the physical condition of the sender and receiver. Okay, if they are having any sort of physical disabilities like sensory dysfunctions which are there. Okay, or the sense organs which they are responsible for the communication, particularly like the speech, the eyesight, okay, the touch, vision that is there. These your ears, okay, for hearing. So if any defect in such organs, okay, can be called as a physiological barriers. In that we have a examples we'll taking. Okay, hearing impairment. Okay, if we know if any problem with their any person, generally it can be of different types. Some people are if having severe problem with their hearing, okay, with their ears. Okay, they will not be hearing completely. Okay, won't able to hear a single word. Sometimes some people were listening or able to hear half or few of the sentences. Okay, so that will be a problematic thing. Then vision impairments. Vision means some the patients if they are having problems like conditions are there like myopia or hypermetropia, means the short sightedness and long sightedness, these are there. Okay, or some persons were having blur visions. So all these are the vision impairment included in the physiological barrier. Okay, actually there is difference between physical and physiological barrier. You should might have studied already in this first year. Then speech, the fluency needed during the communication. If it is having some problems, some people were unable to pronounce the words properly. So at that time, this barrier can be there. Okay, some physical problems are there. That is sickness, illness. The pain is there. Okay, in different body parts, or some people if they are feeling fatigue or stressed, okay, due to this physical condition, the message will not be understood properly. Okay, sometimes the alertness is also a part of physiological barrier. Alertness, that is some traumatic conditions, sometimes shock, mental situation which are arising with any person, okay, which may prevent the brain from understanding the thing during the communication what they are doing. So these all things are said to be a physiological barrier. Okay, and they may be with the patients. Okay, particularly, or maybe with the interviewer, or interviewer means the person who is getting the information. Here it can be a doctor, pharmacist, nurse, whatever, depending upon the communication. And here definitely is the patient. Okay, Then in language barrier, okay, very important thing, language barrier, which is a sort of verbal communication. Okay, things like variation in the speaking of the words, like a variation in the way of the speaking by different people living in different areas may change. Okay, even though there is the same language. Okay, if we'll say both are English speaking, okay, or might be both are, even if we'll take the example in Marathi, okay, in Maharashtra, the people uh, in our area, okay, this what it is called as Nandurbar district, and people living in Nanded, okay, or Marathwada, or even near to us, that is Jalgaon. Okay, they are having some variation in the words of choosing speaking them. So that is a set called as accent, regional accent, or the dialects are variation. I think about the jargon I had already told. Okay, these are technical words which are used by the professionals like doctors and lawyers. Example I already told you. Okay, it should be known to both during their communication. Then different languages which will not be able to understand. Again, very easy example. If an Indian is going to China, okay, Indian particularly on the Hindi speaking, okay, and Chinese people doesn't generally understand the Hindi. So if you are using Hindi as a medium or as a language, it won't be that much effective or completely ineffective, so worthless it will be there. Again, in this language barrier, we can also see users it to be the small voices. Some people are speaking with less tone. Okay, at that time, the understanding will not be properly there. Sometimes grammars and spellings are made mistaked in the written communication, particularly. Okay, because during typing, there are chances of the word might be correct, but the meaning it is changing. Several words are there, the computer will not be detecting whether it is correct or wrong. See, for example, if done, okay, if you want to write DONE, okay, it is done, but DON, actually it is a dawn. But if you are not writing E, okay, it will be changing. Then another example, you can take affect and effect. So computer actually will not be able to understand whether it is wrong or right. It will be telling it is the correct one. So the meaning completely changes. Then there will be problem in the feedback. Okay, if one won't able to understand the language, okay, the terminologies at that time, the problem will be there for unable to give proper feedback. Okay, because of not understanding the things exchange between one another. The cultural barriers are also there. Okay, different cultures are there of the all people. Okay, here the patient and others, uh, because each and every culture is having their own language. For example, if we are Maharashtrian, we will be comfortable with the Marathi language. Sikh people will be comfortable with the Punjabi language. Likewise, the cultural vary. They are having their own cultures. Then eye contact is also important thing in this cultural barrier, because the sign of confidence, sign of politeness, and respect, both are different. If you are looking not looking directly into the eyes of the person, because it can be of both. There is lack of confidence, but sometimes it can also be you are showing the respect by not looking into the eyes of the person. Okay, so these things are there in the cultural value. Then in touch, it is actually cultural barrier in some cultures. Okay, some doctors are not allowed to touch some body parts of the other gender. Okay, like like for example, male doctors cannot touch some organs, okay, each and or every part of the woman as per the Taliban culture, okay, and similar vice versa, female doctors cannot touch the some parts of the this male patients. So it is a gender barrier, okay, actually. Sometimes the interpersonal barriers are there, like see, just here it is mentioned the attitudes, the values any person is having, okay, lack of willingness, okay, some persons are not able to, means they are not interested in the communication, so that is said to be interpersonal barrier. So these many barriers are there, okay, which affects the communication. And simply what I want to say, if we want to improve the communication, we must know which type of barrier it is, okay. We should be able to overcome that barrier, okay, by knowing the problem and knowing the obstacle. We have to remove such obstacles, and then only will be able to make a effective communication, okay. So uh, that's all about uh, the communication and the chapter itself, okay. So if you have not understood anything from this medication orders and prescriptions, you can ask me by personal texting me or calling me. Thank you, take care.